While recent crime statistics seem to indicate that there's a growing trend of kidnappings across the country in the wake of a terrifying trend in South Africa for crime syndicates to kidnap children and demand ransom payments for their safe return. It is the festive season and many children also tend to go missing during this period. Now, with the rise of kidnappings in South Africa, we explore how parents can keep their children safe and the types of conversations parents should be having to build trust and encourage children to report abuse without fear. For that conversation, Dr. Shaheda Omar, Clinical Director at Teddy Bear Clinic, joins us for more. Dr. Shaheda, good evening. Thank you for joining us here on the SABC.
Good evening to you. Thank you.
Perhaps you can give us, or paint the picture rather, of the reality regarding the stats on the ground. We're obviously looking at the info that has been released perhaps for the first 6 months of 2022.
Well, thank you, Liesel. I'm so pleased that you're raising the issue of the risk factors that children face. And I think particularly during the festive period, when parents, let their guard down, when everybody is in a celebratory mood, people are more relaxed and enjoying the festivities, de-stressing, unwinding, and often forgetting the harsh realities of children being at risk. And of course, people are rushing to shopping malls, taking children with, sometimes distracted. And it's those little distractions that could actually result in devastation. Coming back to the statistics, we know that more than 1,000 children go missing a year. And these are the reported cases that have been brought to the attention of the authorities. And in South Africa, as we speak, currently, we've seen a huge incidence in the rise of kidnapping of children, whether it's going to school back and forth, in shopping malls, which again, I have to add that there's been credible anecdotal evidence where there's been several attempts of children being abducted in shopping malls. But again, the statistics do not indicate, or people do not come forward. Having spoken to many parents who have come for support to our organization, to the Teddy Bear Foundation, they have reported that they've been in those vulnerable situations where they've just turned their heads for a few seconds or have been busy in a supermarket, pushing a trolley and being distracted, where their children have been pulled and pushed and the children have actually frozen. And these are not little children. These are older children, 10 and 11-year-olds who can scream and shout. But the children were quite fearful and moved along with the alleged abductor, and they came to the rescue. So these are realities that we all need to be aware of. And I think protection is prevention. So communicating with children, informing them of the risks, but speaking to little children. When we take little children, sometimes parents do not have support systems available. They need to keep children to a leash to ensure that their children are not let out of their sight, out of visibility. But with older children, again, also who have devices, to ensure that they know who they're communicating with, that people will impersonate. We know perpetrators, traffickers. These are people who are waiting to lure children and, of course, perpetrate and violate children, focusing a lot of attention, showing special, favors towards the child online, and, of course, being complimentary to the child. And, of course, with this, children often get lured thinking that they're speaking to an age mate. In fact, they're not speaking to an age mate, but it's a trafficker or a pedophile waiting to lure a child and bait them, and of course, trap them into a vulnerable situation where they become victims of abuse.
Yeah, absolutely. Thank you very much for those insights into kidnappings to date. We obviously have to look at the political and economic insecurity that the country is rather facing, and perhaps how that also impacts motive amongst syndicates and criminals. How would you weigh in on that at this juncture?
So again, I think we know that desperate times call for desperate measures. And the reality is that the economics has a lot to play with how people are baited, and people will communicate and support that. Because if we look at organ harvesting, the muti killings, the kidnappings of children, there's a huge international trade and industry that we are not aware of. In fact, Professor Tanya Robinson, who is based in Australia, who is a South African, has conducted comprehensive research in sub-Saharan Africa, where organ harvesting is a huge reality, and people will sell their children in order to provide for the sustainability of families or sell the children their organs. And I mean, this is something that we also need to be aware of, that unfortunately, economics does have a huge role to play. If we look at the hierarchy of needs, Maslow's hierarchy of needs, it's about food and shelter, and it's about survival. And parents and families will do anything when they find themselves in a situation where they cannot provide for their families their immediate needs.
Dr. Shaheda, just before we get to interventions and methods that parents can employ, I think I just also want to look at the effectiveness of law enforcement to date, and perhaps also respect for the rule of law at large, and what you're observing on that front when it comes to the broader conversation about kidnappings in South Africa. How effective are they?
So the most important thing, of course, the rule of thumb is to err on the side of caution and report immediately. I think that's what we are finding, that people going to police stations, going to the Family Violence, Child Protection and Sexual Offences units, find that they are told, come back after a few hours, that especially with adolescents and teens, to say maybe your child has gone off with friends, or there's been a domestic altercation and the child has left home and will return. I think the important thing here is to act swiftly, promptly, and ensure, because we know that law enforcement, there's pockets of excellence. There are police officers that would respond swiftly and of course, assist with mobilizing some kind of action. And again, there are police officers that may not respond immediately, but it needs to be escalated. And I think that is important, that the shift commander, the station commander, the cluster commander needs to be informed about this if there is not any response.
So then on the back of that, as we look at the value chain and perhaps how society can also assist in this phenomenon that is occurring, perhaps you can talk to us about what parents can do whilst they're having fun to keep children safe, and also what the sort of conversations are also necessary to help build trust, communication and respect, to also enable children to report abuse without fear.
Indeed, and I think that's what's very important, Liesl, what you raise here, is we don't want to instill anxiety and fear in children, because we already find that children are faced with lots of daily stresses and anxieties, and with COVID-19, it has certainly escalated a high level of stress in children. So it's about communicating with children, using age-appropriate communication, vocabulary, words that children would understand. With younger children, your 3, 4, and 5-year-olds, it would be very basic, talking about safe and unsafe touches, talking about good secrets and bad secrets. And also, when we talk about safe and unsafe touches, we need to be very clear that we don't speak to good touches and bad touches, because the bad touches can feel good. Our bodies are programmed in a certain way, and of course, it could evoke pleasurable sensations. So we don't want to instill guilt in children, but making them aware about what is acceptable, what is unacceptable, that they have rights and responsibilities. So again, and with older children, it's also making them aware, because we are finding more and more children who are victims of cyberbullying. And as a result, some children have attempted suicide, committed suicide because of the cyberbullying being so rife, and also making them aware of not sharing images, because with your sexting and sextorting, a lot of sexual images are passed on in relationships, particularly with teens. And when these images are passed on, when the relationship goes awry, often the one partner would release it and it would go viral. And the impact that it has on the victim could be really devastating and soul destroying, but also emotionally collapse. The individual would become totally out of control, feeling powerless, helpless, and hopeless, and of course would have severe side effects and implications for the victim. So these are things that it's about communication and communicating on different levels, but also being aware with teens where they are, who they are with, and also who are they engaging on the internet with. As far as Facebook is concerned, parents need to be friends on Facebook with their child. But also on their devices to be able to track their location, to know exactly where they are, and also informing them or, discussing with them the safety measures of not
Yes.
walking alone or being in places, in an elevator, for instance, going into an elevator, and when strangers come in, not to stay in the elevator. And if they feel uncomfortable, they need to reach out. But also in family settings, it's not only about strangers, but having some kind of coded language where they communicate using a specific phrase or a signal or a gesture, indicating that they're feeling uncomfortable, that something is not right, so that the parent can respond.
Dr. Shaheda, unfortunately, we've run out of time, but thank you very much for weighing in on that. Dr. Shaheda Omar, Clinical Director at the Teddy Bear Clinic, really offering tips to parents. This on the back of the rise of kidnappings in South Africa. We're really exploring how parents can keep their children safe and also, foster the kinds of conversations that can allow children to build trust, but also allow them to report abuse when it matters. Again, thank you very much to Dr. Shaheda for her time.